So welcome to Medical Mondays. Good evening, everyone.
Good evening.
It's a special night for me because we have a very special guest, very special speaker on the forum tonight. The speaker tonight is my middle son, Dr. Marlow Easterling. Is a psychiatrist doing his fellowship presently in Maine in pediatric psych. He's doing child and adolescent psychiatry. He's a fellow at Maine Medical Center. He's an MD, as MBA, MHA, and MBE. Very, very busy. But I asked him to come talk to us tonight because now we have Omicron, another variant of COVID that is ravaging the world. With COVID, there's a lot of mental health issues that people are dealing with. And we felt that it is time that we address the mental health issues, discuss them, and see how to cope during this epidemic. So I'm going to hand you over to, Dr. Marlow Easterling, Korede, my son. Please, the floor is yours.
Good evening, good evening. You didn't tell me that we was gonna be on live stream, YouTube, recording, all of these things. I have to be very mindful of what I say now. And so,
You've been too busy. That's why. Welcome.
But no, I wanted to say hello to Dr. Ogundupwe and my spiritual father, and thank you for everything. It's been too long. We definitely have to catch up, but I wanted to start there, because I may have had an exposure myself. And so I'm feeling a little tired today, but I saw that name pop up and it made my heart smile. So I definitely had to shout him out. But yeah, psychiatry. And, you could Google statistics and all those things. I think my main goal today is to help with solutions or different ways to look at the two pandemics that we're fighting. We have our COVID that we're fighting. We're having an uptick in a lot of mental health as a result of COVID. And it's not just the illness itself, the fear of getting the illness, but I think COVID taught us over the last 2 years that a lot of people, may have been, if this is a threshold, they may have just been over that threshold. And so when the pandemic came, their world changed. So as a result, they dropped below that threshold. And so I've had patients that with no history of mental health. I've had patients with no history of mental health that came in severely sick. No patients with mental health who may be having thoughts of no longer wanting to be alive. All of these things are common across the country, across the world, And so my goal today is to not only answer any questions, to be a tool in case there's anyone that or yourselves or anything like that, to answer any, even if it's a medication question. And I can't, since we're on recording and everything, I can't say that this is 100% correct. So I'm only giving FDA approved treatment plans and stuff. I'm not doing nothing that I may do every now and then. That's neither here nor there. I'm giving only FDA approved if this pops back up. But my main goal is to acknowledge the mental health, but also to provide my way of, it's almost like a rapid insight oriented therapy to allow people to figure out what they value. And by figuring out what you value, it's will also shed light onto perhaps why you may be feeling sad, why someone may be feeling sad. It's a tool that me and a colleague of mine had come up with, developed. It's almost like a teaching tool. So if you try to patent it or anything, anybody on this YouTube or whatever, it's already in the making. Save your time. But so yeah, before I start, is there any questions or any specific areas anyone would like me to tackle? You don't have to turn on your camera or nothing, but if there's any specific areas, you could add it to the chat or just ask me.
I have a question.
Yes, sir.
Doctor, welcome, incidentally, welcome, glad to have you. I know
Absolutely.
you are the fruit that came from this great tree of Dr. O, so it's wonderful to have you.
Thank you.
In pharmacology, there is something called the minimum effective concentration level. That means that you can take a drug all day. If it never hits the effective concentration level, it just doesn't do anything. I am leading to something called a question about being subclinical. Now, you might have patients that you see who are obviously day-to-day doing whatever they're doing, but in truth, they are subclinical. They haven't hit that threshold. Now that we have something which is pushing them, it tips them over the threshold and they start manifesting different things because they have been subclinically, psychologically impaired, but now something has pushed them over the edge. So we never know those who are below that threshold until something kicks them past the threshold. Would you say that is something to be aware of in terms of individuals that you might see and encounter along the way who have very well been okay, but at that threshold, once they hit it, they go off into a different space?
No, absolutely. It's almost similar to what I was saying as far as dropping below the threshold and not know or feeling like you were above it. And to take it even a step further, absolutely right. Because by the time we see them, it's almost like, if you make the analogy, it's almost like when physicians see them or psychiatrists or mental health or providers or even their family members. Mm-hmm. You don't even have to have any type of medical knowledge, but when you see someone who's struggling, you're seeing them when they're drowning at their worst. Something pushed them over, and it's likely that you're seeing them when they're drowning. And so oftentimes you're seeing them and you're automatically, well, what could be going wrong? What's this? It could be something minor that pushed them over that threshold. And so I always tell people, whether it be family members or anything like that, trauma-informed care, of course, but also if you could trace the steps back to see what may have led them offshore to begin with. So not just taking them face value as they're drowning, but tracing it back to what may have happened. If that means, when did this first start? When did you first start having depression? When did you first start having anxiety? Was it kindergarten? Was it this? Oftentimes you see that it started a lot earlier than what we're seeing. And it's just that person over time has been able to manage it. But now there's been too much of a change for them to manage it further, if that makes sense.
It does indeed. It does indeed. Thank you.
Did I answer your question?
Yes, it did. Thank you.
Okay.
So can you address what you have seen in this time of this pandemic? It's a broad question, so you can, just give us your spiel, and then we'll follow with more questions.
The health system is busting at the seams. That's what I've seen. The health system is busting at the seams, and it doesn't matter which area of healthcare that you're in. And it doesn't even, I'm not even saying as a physician, you could be on the custodial team. You can be a person who sits with someone. The system was not made to carry a certain number. Like once you hit capacity and surpass it, all of a sudden, the quality of care goes down. That's, you think like if there's not enough people to treat this, if there's a hospital, good example, there's a hospital and with COVID, you're going to require, 100% FiO2, oxygen, your rebreathers and all of these things. But a lot of hospitals were built so long ago and their systems weren't made to have that much oxygen going through the ICUs, through the internal medicine, full 100% oxygen at all times. So as a result, the patients, before the system literally just shuts down, may only be able to have 80% or 90%. Why? Because it's at capacity, so it's a trickle down effect. And this is all hypothetical because I know we're on YouTube streaming. This is all hypothetical, but it paints a good picture because if we're at capacity and we're over here closing units to take in more COVID patients, then all of a sudden a person who you want to be satting in the 90s, they can only get to a high of the 80s. So they're not even able to fulfill the full amount. And even though you're always taught, it's better to have 2 full glasses than 8 half full. But with the healthcare system being at capacity, sometimes it's going to lead to only being able to have 8 half full because you're trying to prevent death. You're trying to maximize life. So something is better than nothing. That's what I'm seeing. I'm seeing every day new ways to maximize care. And another thing that I'm seeing is that all aspects of healthcare, and I say from the custodial team all the way up to the CEO, everyone, they're tired, and everyone's saying, like, oh, there's not enough staff, there's not enough shortaging, there's not enough that, but very rarely is there light shined upon like what it would be like to be as that internal medicine, those pediatrics, the residents that are now only dealing with COVID, and so I have no idea what it's like to be in a war. This is probably like 1/1,000,000th of what it's like. My big brother, Biggs, but to see death all the time. And this is me hearing secondhand because I'd be the first to tell you, nope, I'm psychiatry. A lot of what I do is telehealth. So as far as COVID directly, no. But to hear patients who are really struggling every single day, it's a different world. You no longer have those patients that are decently okay. But before I go on, yes, question.
I do have another, if I may.
Absolutely.
There are extraordinary lines here in the city. Absolutely unbelievable. Yes, we had COVID, but we never had these lines. We used to have lines now going around a half a block of people who have suddenly come out for whatever reason to determine whether or not they're positive or negative. Has this new variant created such a fear that people are now forming lines, maybe just to find out about their states? It actually, the lines manifest fear. That's what it is. They are afraid of something. So today was 27 degrees. You had people standing half a block waiting online to be tested. Extraordinary. We didn't have that with COVID-19. Now we have it with Omicron. Yes, it's a virus per se, but I don't think it's the virus that's doing this. I think it's the level of fear which has suddenly come forward.
No. I mean, I definitely can see that. I mean, I think also timing. 2 years. I say it a lot. I say we live such a privileged life in the U.S. Such a privileged life to have lotteries, $1 million just to get a vaccination. And I say, such a privileged life to even be able to wait in line. And so I think people are tired. And as a result, they are over here saying, okay, well, I got the vaccination. Am I boosted? Am I not boosted? On top of that, I'm not staying home for Christmas this year. I'm not staying home for Thanksgiving. So if I got to stand in line for this PCR test because that antigen test of that you can buy over the counter is not available, then I'm gonna stand in line because I'm traveling. That couple hour wait in line to give me a little bit of peace of mind is worth me traveling. But before I go on that, Tawa.
Yeah, good evening.
Good evening.
My question is actually not particularly on COVID or Omicron. I'm just wondering if somebody has a lot of stress, can those stressors trigger mental problem?
Absolutely. Absolutely. It's new stress that you're not familiar with, stress that you may have never had to deal with before. I mean, especially, you have individuals who may thought everything was good, thought that they had even been financially stable. And then all of a sudden, job goes, or all of a sudden, you're not even allowed to go to work. You see that the severe, everybody's quitting their job, the great resignation, all of these things change. There's a stressor. Fear is one of the most impactful emotions upon any type of feeling, just fear, because fear can drive anxiety. Fear can drive depression. Fear can drive paranoia. There's so many things that can stem from fear. And so as a result, everything is impacted by that fear. You see anything being worsened. If you already had it, if you already had like a little bit of depression, or, this time of the year is a tough time for people, it gets lighter, later, darker, earlier, then the paranoia associated with that. Yeah. If you have a fear and I can't be around crowded people, all of a sudden now your schedule changes to now you're going to the grocery store at 6 o'clock in the morning before you go.
I knew that.
You're over here, you used to be able to go Christmas shopping on the weekends. Now you're taking time off just to go Christmas shopping at 10 o'clock on a Tuesday, because it's low. And so all those things, even the stress surrounding, where's my mask, all that, over time, we're talking approaching 2 years, it's likely to impact anyone, for sure.
Thank you.
Mm-hmm.
So how about children? Are they exempt? Are they doing well?
No. They ain't doing well. You see the news. Child mental health. That's the main, I think, because isolation. I never, even myself as in training, I never took into consideration the impact of isolation or not having that connection. Even though they tell you about it, I've never really seen the impact firsthand, and how much children rely on their friends, on their peers as support. And I think it became clear that maybe even parents didn't or weren't as close or didn't know as much or wasn't as much of a support to a lot of children as their peers were at school. I'm sure back in our time, there was times where we're like, I'll do whatever so I don't have to go to school, my stomach hurts because I want to stay up late to watch the Super Bowl. I'm not going to go to school tomorrow and all this. Now, like, they're doing whatever they can to get back in school. If they have to miss school, hybrid, even look at the education, suffering, how can the quality, because now you have parents who are at home, you have everyone sharing a space, not being able to focus, not being able to maintain, being on a Zoom meeting for classes, all the distractions and all of those things. So yes, children are absolutely suffering.
So there's a question in the chat box. It says, Dr. Korede, how best can people stay calm right in the midst of all that is unfolding?
I'm glad you asked. So I always say, like, perspective is everything, you know. One way to really gain perspective, and this is just one way I think about it, you know, and this is just taken from things that I've learned from training, but when I'm explaining to somebody, and these things could change or not change, there's 4, 5, 6 things that make up a lot of who we are. And so one being beliefs. Now, granted, it could be anything. I'm just saying, generally speaking, beliefs, relationships, your health, intelligence, external factors, internal factors. And so if I were to number them like 1 to 6, it'd be like that. You know, you probably can't see, but you know, in any specific order, you have your beliefs, relationships, health, IQ, external factors being what people think about you, superficial things, internal factors, how you feel about yourself. And so for majority of us, it looks like this. It's almost like an upside down pyramid, if you could see, with whatever you value the most being number 1, above that 2 and 3, 4, 5, and 6. It's like a top. So that anytime, whenever number 1 is impacted, so anytime there's an impact to number 1, as in like something goes and barrels the bottom of that triangle or that pyramid, everything else comes tumbling down right here. As you can see, the arrow is going down, something impacted number 1. An example would be if relationships mean the most to you. If a significant other cheated on you, if a friend didn't show up when you needed them to show up, if you're arguing with your parents, or if you're a parent arguing with your kids, if that's going on, and that's the most valuable thing to you, then your whole world tumbles. You know, your whole world. Doesn't matter what else is going on. You could have just gotten hired, but if that's not right, your whole world crumbles. So ideally, and they're supposed to be equal, but this is me just drawing. Ideally, I see a big, you would like it to be like a rectangle, like a solid foundation, and they're interchangeable, fluid. Whatever is number 1 this year or in this journey may not be number 1 next. I will say, after doing this with patients, that I'll give everyone, out of beliefs, relationships, health, IQ, what people think about you, what you think about yourself, what do you think has commonly been number 1 or 2 in those who tend to do better out of the patients that I've seen? Now, just the ones that I've seen, could be coincidental, could be whatever, this ain't fact. I don't want to say that, but just I've noticed out of the ones that I've seen, anyone. Beliefs. What you stand for. Your principles. Oftentimes, whether it be faith, your beliefs, what have you, when that's been number 1 or 2, yeah, I just wanted to throw that out there, Dr. Ogundupwe. But yeah, when your beliefs or your faith's been number 1 or 2, my patients, those ones tend to do a lot better. And the child, the child and the parents, when they're on that same, when they're 1 through 6 line up, the dynamic of the family is also stronger. So, Biggs, you asked a question?
Yeah, yes, I have a question, man.
Your big
sorry,
bro.
I'm calling.
You know,
I'm from overseas.
It's overseas
so
right now.
Yeah, just want to just wanted to throw a question in there and also throw a thank you to you, Dr. Easterling, for providing your services in this matter and for giving us your time and your knowledge and intelligence on this particular subject. The question I have pertaining to this topic, I'm curious to know, because it has been 2 years since the start of this pandemic. I know a lot of researchers and psychologists and psychiatrists in your field are pretty busy right now, and therapy, particularly, is probably a booming industry right now, with all that's going on. But I'm curious to know, have there been any new or significant techniques that you and your colleagues have employed in treating your patients, or at least any kind of research that you've developed in treating specifically COVID related effects and symptoms?
No, I haven't. I haven't changed my treatment modality. I'm sure it's out there. Unfortunately, I've been so busy with my caseload that I probably haven't been able to really notice as much. I mean, also being in Maine, although we have had a crazy uptick in cases, a very strong uptick in cases over the last week or two. But it's a fairly small state, and we were amongst like top 3 for like vaccination rate. And so I haven't really encountered that many children who were COVID positive, or as of yet, in my clinic. I've had some, but not enough to really lock in a different type of treatment or anything like that, or the everlasting effects of having COVID. I haven't had enough experience to really say. But I'm sure it's out there. Madam Law.
It's good to see you, brother.
Absolutely, man. Let me know when you're coming back to visit.
Will do.
Auntie Larama.
Yes, good evening. Welcome back, Dr. O.
Thank you, ma.
See, you're looking American now.
Thank you, ma. Korede and Obafemi, you've not met Auntie Lara. You will meet her. I can't met her.
Yeah, that acting. He abandoned me. Anyway, Doctor, I appreciate what you said about there's been a lot of fear in the past 2 years. People have, and that unfortunately has amplified the level of anxiety. How do you unstigmatize mental health to help some people get help? Because there are people that are not getting help. And you can see that their functional capacity is subliminally diminishing, but they think they're okay. I'm okay. Because of the stigma around it, particularly employees, because it does domino into so many other stuff, but they're not getting that help. How do you unstigmatize it? What would be the right word to say? I'm not asking you to do HR, but from a professional point of view, what would be a better
whenever I'm talking, I always keep work and personal like separate, which has gotten a lot harder with the pandemic. And so but I always tell people to how do I put it? First, with my patients, I always start with the positive, because chances are, if you're seeing me, there's already a negative stigma associated with it, and you're coming to see me because there's a problem. So I always like starting with the positives. And when I say starting with the positives, I always ask them, I'm like, what are some of the or the dad, what are some of the things that you love about Billy or whomever, you know? And then they'll say this, this, and this, and I'll ask, you know, Jane Doe, John Doe, you know, what do you like about your parents? Name some positive things. And what I've found is that not only does it set the tone for our thing, you know, it lightens the mood a little bit, but also it's been so long since a parent's heard those positive things that their child loves about them, and so long since even the child has heard a lot of the positive things they've said about them. And so I always start there, but then I also acknowledge that no one knows what someone's feeling better than them because they're feeling it. You know, it'd be arrogant for me to say you're this or you're feeling this because only you feel it. And so I said all that to lead as a segue into, okay, fine, you're okay. So what does okay look like? What does okay look like? You're okay. So what does okay look like? Well, you know, I'm going to work and I'm this or I'm that, okay. And so before, when you were doing this, was that okay? Or was that great? You know, by allowing them to explain what they feel okay is, explain what they feel good is, you know, explain what they feel baseline should be, oftentimes allows them to realize that there may not be good, or they may not be at baseline, you know. All those positive things that I said, when's the last time you felt those? You know, it built up some feelings. Right? Yeah, wow, that was nice hearing that. When's the last time you felt that? I don't know. Is that okay? Is that baseline? You know, and so I always allow them to figure it out by just a little nudge here. But if you're okay, what does okay look like? If you're happy, what does happy look like? And so oftentimes when they can't, or the happiness isn't really happiness, or okay isn't really okay, and they say, okay, well, when's the last time you felt like everything was what you feel is okay, or what you feel is happy? Why do you think that is? Okay. How can I help? And they always say, nothing you could do. This is just how it is, nothing you could do. Okay. But if I could, I know that I can't, but if you could just imagine someone being able to, what would that look like? And I know I said, because if somebody asked me that question, I said, it probably looked like, I don't know, I need like Elon Musk, Jeff Bezos money without the responsibility. And I say it because I'm gonna donate it to a lot of people. And I'm then just gonna retire in like a mini house on an island and be like a tour guide. That's what I feel like I'd be really good at. But once again, we're on YouTube, so that's off the thing. I feel like, you know, I respect tour guides, but I feel like, you know, you're in paradise, you get to bring joy to people, but either that or a background dancer. I feel like, you know, you get to travel the world, respect them too, but I'm getting off topic. But I say that, you know, what does it look like? Because oftentimes someone can't describe it. You know, what does that look like? You know, well, my relationship, even if the relationship's not going well, what does a healthy relationship look like? Well, you know, one that's loyal, somebody who's trustworthy, all of these things. Okay. Well, you're in a good relationship. You feel like you have all those things? Well, could you? What would need to happen for that to happen? And so you always stay curious, and you always pose the question to them, what would it look like? If that answers your question.
Thank you. I mean, it never hurts to stay positive and keep drawing from them. But, you know, I guess it's easier to back up when they say, well, I'm okay. Because if somebody says I'm okay, you just back up. But you're saying, no, keep poking until they're able to define what okay means.
Yeah. And it's a give and take. And then when they do say, and this is, and mind you, I'll be the first to tell you that I was not good at therapy until I went into training to a very therapy heavy program, which is why I went, because I had like no experience. But it's being able to not only stay curious, but also acknowledge, okay, so you're saying that being stressed, this arguing with so-and-so every day, this talking bad about someone every day, this lashing out at someone every day, that's what I'm hearing that all of these things is what you would picture okay looking like. If somebody said that to me, I'd be like, well, no, I guess that ain't okay. Now that you say it like that, well, you know. And so it's being curious. And once they start opening up a little bit, saying, so what I'm hearing is, okay, you know, to you, because everyone's okay is different, but to you, okay is this, 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 and this. And if that okay is not okay, what would an okay that's better than that look like? So the goal is to always allow them to come back around and actually like hope or try to see what better looks like without you telling them. Because you don't want to bully anybody. Because once again, nobody knows what they're feeling better than them.
Okay, very well. Thank you, sir.
You're welcome.
That is tough. It's difficult, especially for somebody like me. I'll tell you as it is. But you're saying that, you know, it's best to let people, you know, just guide them.
Mm-hmm. Because if you want everlasting, you want something to actually stick, they have to come to that on their own. You know, you can't be paternalistic. If you want something to stick, they have to arrive at that on their own, you know, by telling them you should this, you should that, you know, like as providers, as friends, as family, as anything like that. It's not your job to preach. You know, it's not your job to preach. Not everybody should be preachers. Ain't that what the Bible say, Dr. Ogundupwe? I just had to put that out there. That was at one of our Bible studies as well. But anywho, I would say that, yeah, they have to arrive on that. As their provider, as their friend, you're there to help them arrive there. Help them see, not by telling them, but just being curious about, well, what does it look like? If we're not there, I know that you think you can never get there, but what would need to happen? Well, I need that Jeff Bezos and Elon Musk money. Well, you may not be able to get their money, but maybe by doing this, you'll be able to get 1/1,000,000th of their money, which is better than none. You know, so it's all about that give and take and saying, okay, all right, and staying curious. Because by staying curious, you show that you care.
Yeah, I guess the difference is that you're paid to listen. Some of so that's really what you're trying to say. You must intentionally listen. Otherwise, if somebody say I'm good, okay, you're good, then that's fine. I'm, you know.
Yeah, exactly. If what you see may not necessarily be good, you know, oftentimes, you know, anybody could be smooth at talking. As physicians, we all, you know, as providers, as whatever, you know, anybody can be smooth at talking, but try being smooth at listening. That's a quote from Life Jennings, one of my favorite songs. Try being smooth at listening. Not just I hear you, I'm listening to you.
And that is helpful. When you know that somebody is connected, they actually care. It makes a difference. So
because when you see someone with mental health, you're seeing them, and oftentimes they have no one. They feel like no one cares. They feel like no one's listening. So what's the point? And lastly, I'm going to say, don't try to change everything in one visit. You may have to be curious for 3, 4, 5, 6 months.
Well, during this time of COVID.
No, I'm with developmental health too.
Telling you, you got to stay curious. And as long as you keep asking, oh, are you still okay? Well, what okay looked like, has it changed? Okay. And before you know it, mark my words, they will say, you know, everything ain't okay today. Something will happen with it. You know, it ain't okay. Oh, patience, patience.
So, Dr. Craig said, as a family member who has a senior in a nursing home who you are not allowed to visit, what can you do other than trying to call, visit through a glass, and all of that? You know, people are experiencing that a lot now in the hospitals. Family members are not allowed to stay with their loved ones. Even, you know, when people are having babies now, every hospital has their own rules and regulations, but some don't allow any family members. Some, if the family member is there, then they're not allowed to leave. If you leave, then you can come back. How do you, what do you do? What else can you do? How do you handle that?
I always tell, and mind you, everyone has their own ways. This is just my opinion or what I've made recommendations is depending on the situation, everything's situation specific, but connection doesn't have to occur with presence. We have technology, which is mind blowing. And even though everyone has Zoom fatigue, I always tell everyone, I said, for children in their 40s, 50s, their parents are in nursing homes. I said, one way to bond or to continue to create that is whether it be a puzzle, you could drop the puzzle off, whether it's a crafts, you know, a crafts project where you, if it's me and Biggs, we'll do a crafts project that's something that made us laugh, you know, whether it be the calzones or something and this, or it'll be the spicy fried chicken rice, you know, and then we'll attempt to make that dish. And then if Mama, if you were in nursing home or something, God forbid, but you draw the spicy chicken rice, or you say, you know, I'm gonna make some rice and this, but it's about building that connection towards the times where you remember those happy memories, because it allows that connection to still be there. The hobbies that you used to do, it may change, they may look different, but to still say everyone's working on this together or everyone's doing this together, it allows for that sense of being like, okay, well, you know, remember back in the day, we used to play spades or we used to play this card game or whatever. Okay, well now we're about to play, or on that Zoom, whatever, we're about to get this app and go back and forth and what have you, you know, or we're gonna draw the game, you know, so still being able to participate in activities that allow for the connection, even though you're not in their presence.
Thank you so much for that. You know, I'm not gonna lie, I didn't think of that. And as you said that, I remembered something that I used to meet you guys at the gym in the mornings. That's something that can be recreated, you know, even though there's distance, but we can still exercise together by Zoom or something, lifting hands, you know. Hold the hand up, I remember. Okay, so thank you so much. That is insightful. So there's another question here. Brother says, thanks for educating us and giving us all the positive things to do. What are some possible lingering mental effects of COVID-19? What class or age group of people are struggling with the post-COVID recovery? We have that syndrome now.
I do not know.
There's a third question. I'll wait for you to answer those.
I do not know. I'll be the first to tell you. And I have an idea, but I always say, since I started medicine, I am confident in what I know. I'm very confident in what I know, but I'm even more confident in what I don't know. And so I will say 100%, I don't know.
I'll answer that question. There is a post-COVID syndrome that some people are having, mental fog, fatigue, shortness of breath. It varies in person to person. We're still trying to figure out why. This is a virus. We've never had a virus do this and leave such lingering effects. Of course, when people cannot go back to their baseline, when they're not feeling well, they cannot go back to work. There's a doctor that I heard about who can't practice since last year because of the brain fog. Of course, there'll be mental health issues associated with that. You know, it's possible for somebody like that to have depression, anxiety, not knowing what would come next, not knowing if this will resolve. Researchers are working on it, but it's still there. We don't know why it's happening, and we don't know how to fix it. The mental health issues, I guess, you know, people like, psychiatrists would still treat the way they will. I mean, I'm a family practitioner, but I've treated more mental health issues than I've ever done in my career since COVID. Patients cannot even get to see psychiatrists sometimes. So it falls on us. And I don't get paid for treating mental health issues, but it has to be done. And when Dr. Korede was talking about how we feel also as physicians, is part of that. We too need help. We're resting on each other for support, for counseling. So the mental health issues with these lingering effects of COVID is a real thing. And the lingering effects are real. We hope that we get solutions.
And that's a perfect segue to, I think it's been a very fruitful conversation. We all should get some rest, some sleep for our days. If there's any questions in the chat, I will definitely
wait a minute. There's a third question asked by that person. Are people being more honest these days or otherwise? Some are using COVID-19 to get away with stuff, rightly or wrongly.
I'm not going to speak to that as it's an opinion. I can't speak to, because some will say, I think everybody's being on the up and up. Others will say, this person is doing this. Everybody's trying to cheat the system or to do this. And so as a psychiatrist, I can never ever really speak to opinion.
Okay.
I can only speak to.
You're right. You are absolutely right. And none of us really should. There's Femi, your bro, is asking, as you know, children have been especially affected by conditions and protocols enforced to combat COVID. Depression, anxiety, violence towards others, and suicide has risen sharply amongst the younger generation. What can you as a medical professional, or how can you as a medical professional impart, let me read it right. What can you as a medical professional impart to parents on how to care and raise their young children's mental health and growth? That's a big one.
I mean, as a child psychiatrist, you're almost like a family psychiatrist.
Mm-hmm.
And so one of the reasons why I wanted to be a child psychiatrist is because I love to impact systems. And a family system is one that I feel like you can make such a significant change in just by like something. And so oftentimes, even when you're seeing the child, you have to look at the parents, you have to look at the home, you have to look at all of these things when you're really just seeing the child. It's more than just the child, So sometimes I refer parents to therapy. Sometimes I will refer them to one of my colleagues for adult psychiatry and give my recommendations of if I see something in a parent that maybe could possibly be depression, could possibly be anxiety, because oftentimes if you fix what's going on in the caretaker, the parent or something, it'll change the outlook and the experience of the child in the home. But in addition, I'm a huge advocate of family therapy, because family therapy allows for everyone to be heard and for different aspects of the environment to be seen that maybe not was seen previously, because I think communication is something that's oftentimes like at the core of a lot of discord in homes. And so parents may oftentimes think that they're loving their child, they're giving them everything they need, they're giving them the world. But what if the child says, I don't want what you think is the world? My world and your world is different. And so if a parent that never hears that, how can they ever understand it? And so oftentimes that's what I always recommend is family therapy. Before I even recommend a medication therapy, family therapy, to see if there's anything that's being missed as far as communication or experience with one another, sharing a space in a home environment.
Thank you so much. And thanks, Femi. Yes, Sister Lola here appreciated you asking that question. That was an important question. Yeah, Pastor Manasseh has his hand up. Kindly unmute. Great.
Oh, sure. Thank you, Dr. O. And thank you,
Dr. Pastor Manasseh, sorry.
Thank you so much. So I just want to go back to the question of the honesty. Somebody said people are not being honest these days. And the doctor responded that it would not speak to opinion, which I do agree. However, he said something earlier about if somebody said, I'm okay, you can't just accept the okay as okay. You got to be poking, staying curious to know what's going on and what's okay. Mm-hmm. So wouldn't that be the same issue here? Because if somebody is saying something, then there's a red flag. Mm-hmm. To accept that it's an opinion that somebody is not being honest, and therefore you don't want to poke to find out what's going on really. Just like, the question that was asked about the child, children's suicidal thoughts or tendencies that is going on with the pandemic. So it's also speaking to the fact that there may be something. I appreciate the fact that you want to refer the family for counseling, which is great. Mm-hmm. So I think that we cannot just ignore the fact that somebody may say I'm being honest or not being honest to get away with either chores or get away with something. We should ignore it. So I really want us to readdress that issue, because it may be a flag to something that is happening underneath that we need to know to help before it's late.
Oh, thank you, sir.
Thank you.
So my question to you is, what does dishonesty look like?
And again, someone says, I'm okay. How would that look to you? So again, I can put it back to you again.
Well, if somebody is, and I'm seeing this patient all the time, and they're over here coming in well-dressed, usually everything, nails done, all of this, and all of a sudden they come in disgruntled, or they're crying during my visit. I'm okay. Well, something's changed. How do you tell who's being dishonest?
Exactly, and that is what is leading me to, if someone said they're okay, why wouldn't you accept that they're okay? Are they not being honest by saying they're okay?
No, I'm not saying okay. I'm saying if you come into the office and you're telling me everything's okay, but it's a change from baseline. It's a change from baseline. You're disgruntled. You're not looking the same. You're not acting the same. All of this, and you tell me it's okay. That's going to raise some red flags. How would someone come into the office and I would be able to tell they're being dishonest or they did something dishonest?
Difficult, very difficult.
Yeah, I think also that we're not judgmental, but maybe the person is not ready to talk about it then. But you know that they're not quote unquote okay by socially acceptable conduct. You know they're not, especially if it's someone that you're familiar with all the time. But you helped me out to say, okay, I mean, you don't need to be, you don't need to give up, but in a subtle way, keep poking, keep trying to help them speak, take the lead and define and say, I think I got you. Thank you.
And I'm just saying, like, and I had said, don't try all in one visit. I said, this may take 3, 4, 5, 6, 7, 8, 9, 10 months, but it's showing that you care. When it comes to dishonesty, how would I tell if a patient came in and they're being dishonest? It would be based upon someone else's letting me know. So that means or something happening, it would almost be like secondhand if it's dishonest. I've never had a patient come in and tell me, I'm a liar, I'm a thief, I'm being dishonest, I'm this, But I have had patients that came in and said that, maybe I'm struggling, I'm stressed because I've had there, or I've done this. I think that's something different. But I think as far as like, for me to determine whether or not you're being dishonest or honest, I just feel like it's something I really couldn't speak to, because how would I know?
Unless something cues you to it, like you said, it's.
Now, if the police come in and said you done stole something and everything, and you tell me that you didn't, now we could talk about dishonest. Or at least I would have something to even like, because even then, innocent until proven guilty. But if I'm seeing you every day and you've been this way, and I'll even go and say that I'm not going to say, are you okay, to a person on my first new patient evaluation, because I don't know you well enough. I oftentimes don't even make concrete diagnoses on my first visit because I don't know you well enough. But if there is a way to be able to be curious about dishonesty, or the way that you think would be better, anyone, I'm open. Please.
It's tough. In medicine, we train not to judge. We cannot be judgmental. Otherwise, you will miss diagnosis. You miss doing the right thing for your patient. So that's a tough one. Unless something really happens, like you said, it's difficult to know if somebody is not being honest. But while go ahead.
No, I think I agree it's tough, but I think with time, we'll be able to pick up some other cues that will lead to what's actually prevailing. My point is not to ignore people, to put them in the bracket that they are either getting away with stuff. Like a child in the home doesn't want to do chores. They say, I have pain, I have headache, I have this, I have that. Sometimes you can pick some of the signals to know exactly what they are trying to say when they don't want to do certain things. But again, we still don't want to be opinionated about things that may mean nothing. And, my point is to make sure that we are not taking the minor as major or major as minor. We have to take everything into consideration and have other cues to help us be able to. I'm not saying we should diagnose people that this person is a liar or this person is this or that, no. But let's have everything observed with time. And then we'll be able to help out so we avoid all these unfortunate, tendencies of youth committing suicide that's, it's prevalent these days. Thank you very much for your contribution and answers.
Yeah. No, excellent point. And I still have to ask, just curiosity, is if the child said that they had a headache, stomach ache, and everything, even if you suspected that it was for chores, would you still further investigate the headaches and stomach ache every time?
Absolutely. Because
If-
they may have headache.
Mhm.
They may have stomach ache, something may be going on. That would be my first thing. You rule that out first before you come to the conclusion that, wait a minute, is this person trying to get out of work?
Absolutely.
Yeah. So
Okay.
there's a question here. My sister Masha, one minute.
I even have another Zoom meeting about a research project that's at 8 o'clock.
Wow.
I didn't realize that.
Okay.
Okay.
It's a research project actually about suicide in children and the uptake.
Oh, wow. Mm-hmm. You've done fantastic. And for the fact that all of a sudden you are under the weather, probably exposed, to God knows, is it COVID-19 or Omicron, what have you?
Yeah.
But you'll be fine by the grace of God.
Yeah.
And
I'd be open to having another presentation or anything after the holidays. Absolutely. Whenever you guys would, if you guys would like to have me back, I'd absolutely love it.
Yes, we'd like to have you back because
why not?
We are not well until we are not well until we are all well.
Yes.
Going on. So we need to talk about it.
That is true. So we'd love to have you back, but we'll let you go so that you can go to the next Zoom. And you take care of yourself.
Yes.
Okay.
All right.
Thank you, Dr.
everyone.
Doctor, take your own advice. So there's a question here. The next question here says, how can a layperson help when a friend or loved one who lives alone appears to be rapidly deteriorating, but might be resistant to seeking help? That's another tough one. It's there are guidelines, and I'm glad you are a lawyer because the law protects people's choices. Somebody have to want to be helped, especially when it comes to mental health. Otherwise, we cannot force medical help on them. We cannot force mental help on them unless they are suicidal or they are homicidal. They want to take their own lives or they want to take the life of someone else. Then they can be committed by law. But other than that, there isn't much one can do in this situation, which is, it is the way it is. We have to follow the law. Did I answer that question?
Yes and no. I'm right back where I started because that's part of the problem, You know how there are situations where people are too sick to not need help, but not sick enough where help can be forced upon. If that makes any sense.
It does.
When you the visits are all virtual now. We people we haven't seen in years now. Some of them, and in one particular instance, I can tell people have started. This person has started to rambling. Another friend who lives by says that this person has dropped off a significant amount of weight. I know that our conversations have become much more disjointed, but they're not ill enough to send in an emergency team who could at least start the procedures for, getting short-term help. But it's obvious that they're just not functioning. And so much of it in this case is because a person is such a gregarious individual during normal times or whatever's normal anymore. And so one can, I guess there's nothing to be done at this point except pray.
Well, there could be. If this person has power of attorney? No, they don't. They don't have any.
Parents are deceased and sibling. I don't think there's but one sibling, and the sibling and this individual appear to be estranged.
Mm.
And you know, an individual who is very social has a wide circle of friends, all of whom are concerned, but no one can really get to each other right now.
There is still something to do.
Mm-hmm.
If you, as a friend, a close person, or some friends can get, it's two doctors, maybe a primary care doctor, their primary care doctor, this person's primary care doctor can, you know, they've known this patient, they can ascertain that there's a change in this patient. They can get them evaluated by another physician.
Mm-hmm.
You know, usually maybe a mental health, a psychiatrist, a mental health person, or, you know, whatever their ailment is, another specialist. If they can ascertain that they cannot take care of themselves anymore, the testimony of these two doctors will commit the patient to better care.
But we're talking about the person being ill enough to warrant being committed. That may not be the case. It's not at this point.
Okay, let me give you an example.
But
Okay.
Yes,
Dr. O mentioned a key word, ma'am, about power of attorney. Maybe you can have conversation with this person to find out what are the things that are important to them, even at this stage.
Mm-hmm.
You know, what kind of help would they want? Because you're talking about a much more serious case than the question that I asked. Well, how can this person identify what is important to them? Maybe, you know, to get well, even in terms of food, what kind of support they need, what kind they don't need. Because the way you're describing this person is deteriorating, and Dr. O is talking about power of attorney. So if this person doesn't have it, maybe this may be a time for that person to start to write down the things that they want. What's their vision of a good life, or how you know they want it to end, something like that. But that's a key.
Gratifying, because that's some of what I've tried to do already, just to ease into the subject a little bit more. In fact, and this person has already, I referred this person to my primary care, who this person knew but had not been treated by, but has high respect for, to start maybe suggesting that some other types of help would be available. But I heard you all say something earlier about Dr. O, your son was talking about people being truthful, and I, you know, had been able to ask some pretty pointed questions, and that they were being avoided. But at this point, circle of friends have brought in supplies of food, or have made, and the individual has been receptive of some kinds of help. But the concern is just being able to get them to be able to either successfully live independently or be accepting of more help than might be available right now. But it's
so
like watching
there are ways to strategize.
Mm-hmm.
One way, you know, the primary care doctor, and I'm glad you referred that to your primary care doctor. So the primary care doctor can get a lot done. For me, when I do physical exams on my patients,
Mm-hmm.
about once a year, I talk to them about power of attorney, who they will pick to make decisions for them if they are ever in a situation where they cannot make medical decisions for themselves.
Yeah.
And they'll pick somebody, then give them a package to fill out, to document that they bring back to me. It's occurred in our practice that, patients are then they needed that. They could not make decisions for themselves anymore. And wherever they are, the hospital that they're in would call us to ask if we have a power of attorney on file, and we've been able to help out that way. Mm-hmm. In this instance, Auntie Lara made a great point. You can start talking to this person about what they would want in certain situations. Yes, they can evade you in some places, but you'll be surprised that they may tell you some things that they will wonder, oh, I want, life support. I don't want life support. I want, whatever they want. And ask your primary care doctor to, draw up a power of attorney on their behalf and see if they can make you, if this person can make you their power of attorney. That's one. Again, your primary care doctor, if they feel that the person is not competent anymore, they can get another doctor to agree to evaluate the patient. Mm-hmm. There are simple tests that we do to ascertain if somebody is competent or not. And if they find her not to be competent, then they can get, adult care services involved that will probably put her in a nursing home or, adult living facility where she'll be able to get better care, better help. You can do that. Those are ways to, to be able to assist her. So she doesn't have to be very sick or too sick to be able to get the kind of help she needs.
Dr. O, in addition to what you said, there's also one called in-home support services, because there are people that don't want to go to facilities like that. So that kind of help, they will qualify for people to come, make their meals in the morning, clean their bed, whatever it is, called in-home support services. That's also available if that person is at that stage that they need that kind of help. But it would have to be recommended by the physician, like Dr. O said.
Yeah. This person's pushback is primarily, it's not so much the physical as it is the mental or emotional.
Yeah, it's about control. The person still wants to be in control of their life. It's about control. And you can't make it a power struggle. So I'm saying, because I'm also a professional in another level, that the psychiatrist that left us, what I learned from what he told us is you start peeling the onion. If they let you do a little bit, then you gain some inches, and then little by little, maybe other things will unfold. We cannot unpack everything at once in a way that makes them feel like they don't have the autonomy, which is what they're holding on to, So, but this is a very serious case. So maybe if they know that somebody else will be providing the help and they feel like they're not a burden on families and friends, maybe they would take it. So in-home support services is a resource that is available that you could look into.
That is true. You can help this person. Honestly, you can, through your primary care physician. The in-home care is probably for somebody like that, because they're strong-willed, as you said, probably won't want to leave their home, their setting. So people come and even help them with medications, make sure things are done properly and stuff like that. You can help them with that, but it has to come from the primary care doctor.
And also you can contact the adult care servicing and inquire about how best they can help her too.
That's another thing. You'll be surprised. These adult care personnel, they are fantastic. They'll figure out a way to work with her where she will still feel like she's in control, but she'll be able to get the help she needs.
That would be wonderful, because this individual is very much invested in being in control. And the home is still clean and neat and all of that, but it's the other part that's a concern. In fact, this person has only let 2 of our friends see, go on a Zoom, and we're just guessing. None of us in this circle of physicians, but from what we've pieced together, I wouldn't be surprised if she got diagnosed anorexic. But she still dresses well. Her home is immaculate, but
Anorexic, or if she has some form of dementia, you mean?
Good point. Good point.
And she may. And these times of COVID does not help. When you can go out and socialize the way you normally do, you choked up in the house alone, it's causing a lot of, a lot of regression in people, especially the elderly people. Yeah. Elderly people can, just dump like that and just regress so quickly because there is no interaction with people. They are locked up in their homes.
And so that's the greatest fear in this situation, because as I said earlier, this individual is extremely gregarious, very wide circle of friends, and is engaged with friends, sends notes, calls, all of that. But people are piecing together that something is not as it should be, and so we won't turn it loose, but I'm happy for the opportunity to get some more insight and some perspectives from folks who are trained in the area.
Great, fantastic. I'm glad we can help. It's on this forum, we don't establish physician-patient relationships, but we do our best all the time to give, the best insight.
Dr. O, sometimes it helps just to know what questions to ask. It's not always knowing the answers, but if you know the questions to ask, one can get down a path much more quickly. And you all have helped, because I can share this, because a lot of the friends of this individual, even though we're scattered around the country, communicate in order to try to keep those arms around them, because we know what's going on, but it gives us more to work with. And I appreciate this.
Thank you. Thank you for the opportunity. Yes, go ahead.
It's a quick one. I'm curious to know what and where do we invoke conservatorship? When somebody is not willing and the power of attorney is not kind of applicable in the situation where the person is competent, can you invoke conservatorship?
No.
Conservatorship.
Yeah. No. Doctor,
I can't speak to that.
It's either homicidal or suicidal, those, especially for an adult. No.
No, you can't do that.
Unless it was already on the, what is the thing that Dr. O mentioned? Power of attorney.
Yes.
A power of attorney can only be granted by someone who's of sound mind.
That's right. So if it's not existent.
And guardianships are often done. Sometimes individuals who have not been deemed incapacitated can actually agree to a conservatorship or guardianship, and in anticipation of something that may happen in the future, or just because they want to pass on that responsibility. But those are not relationships that develop without some legal intervention, even if they're uncontested. But it's become even more difficult in recent years to get help for people you might know need it desperately. And I guess in some ways it's good, but it's terribly frustrating when one can see an individual who is in dire need of some assistance, some direction, some guidance, who, because of the way the laws are structured, it's very difficult to get.
Yeah, also, ma'am, similitude manifests itself in different ways. For some people, just forgetting car keys alone can switch them over.
Yeah.
Yeah. So many underlying conditions, like Dr. O said, during this COVID, that people did not even know that they have, has been amplified, unfortunately. So one little thing, just cross it over. Make people cross over, unfortunately.
Yes. Yes. And somebody is talking about asking, I think they're asking the difference between power of attorney and healthcare proxy. Those are different things.
Yeah. One can have a power of attorney for that's expressly for healthcare purposes, but that's going to vary from jurisdiction to jurisdiction. But generally, a power of attorney is the granting of specific powers by an individual who has the capacity to do so to another individual for purposes of handling some specific tasks. And they're usually for a set period of time. It's tough to get one that's open-ended because nobody wants to have someone who is not incapacitated give away their power of autonomy.
But, yeah, you can Google that. You should Google that. It will break it down for you because, it just will be guessing to be able to give that kind of professional definition.
No, she's a lawyer.
Oh, okay.
She's a lawyer. That is correct definition. She's right on point.
Okay.
Sister Marsha is an attorney.
Okay.
Right on point.
Certified, yes.
Yeah.
But
what did you say? Dr. Manasseh, did you say something?
Right on point.
I said,
okay.
I said nothing, but we are learning great stuff. Good job, Dr. O. Medical Monday is bringing us into the arena of so many things we've taken for granted, and we need to know about all these things. So I really appreciate everyone, every contribution. Great stuff. Thank you.
Thank you. Thank you so much. And Dr. Ashby also said this was great and timely. Pandemic fatigue is real, and post-COVID syndrome can be debilitating. That is true. So this brings us to our Medical Mondays moment. I want to praise God for the opportunity to serve in Ghana. It was amazing. We saw 2,100 people. We were in Accra and we did a day in Cape Coast. Diagnosed, it was incredible. Like every other person having this skyrocket blood pressures, 240 something over 130 something, walking around. Blood sugars over 300 was like a staple, over 400 was like a staple. Breast cancers, we did breast exams, and we actually diagnosed quite a few breast cancers. Unfortunately, some of them women have paused already from the nipple. It was, but it was a blessing to see get diagnosed and be able to connect them to care. A lot of eye conditions. It was just a blessing. The people of Ghana are beautiful, wonderful people. Oh my gosh, genteel people. And we were able to also minister to them, to share the love of Christ with them. Some gave their lives to Christ, some rededicated their lives. It was just it was an awesome time. We also had the opportunity to go to the castle where slaves were kept before they were put on on ships.
Cape Costa, Elmina.
Yes, ma'am. Yes. We went there. That was a very emotional experience, but we're grateful that when we went out through the door of no return, we were able to come back to return. So we returned, and the aquava, meaning welcome, that was written on that wall means the world to me. I could not believe what kind of impact it had. And I just want to praise God for the opportunity to have been able to go, and for this time. It was an awesome time. So that's a Medical Mondays moment. And I came back from Ghana today, very early in the morning, and I'm happy to be here on US soil to participate in Medical Mondays after, at least 3 weeks away. So thank you so much for coming, for participating. I didn't see any email from anyone to tell me that they brought 10 or more people to the forum. So there will be no champion or gifts given for today. Please remember to email if you bring 10 or more people to the forum so that we can give out that gift. I also want to shout out to my sister Lola Aromolaro, amazing woman. The Lord made her an angel for me. I was already on the plane, shortly before getting on the plane, I found out that my children around, that I thought one of them would come pick me up. Everybody had to work one way or the other. But I was already on the plane, and Sister Lola called me and texted me. So I texted back that I was en route back. One conversation led to the other. I mentioned that, I'll be coming from Dulles and I have to figure out how to get home. My flight landed at 4:45. I told her, we'll be there at 5 a.m. She told me she will come get me. She lives in Colombia, 45 minutes away, at least 45 minutes away from the airport. And she was there at 5 a.m. to pick me up, to take me home. So I just want to say thank you, because she was an angel that the Lord used to get me here this morning.
Amen.
Sister, thank you.
Thank you, sister.
She's on the forum. Sister Lara, show your face. There you go. I'm asking you to unmute. So just, I just want to say thank you.
Thank you, and God bless you.
You're welcome, Dr. O. You didn't have to do that. Please.
Oh, I had to. You are my angel.
It was a pleasure. Thank you.
I appreciate you. So next week, we'll be back on the forum. Guess what? We have a treat coming up. We're going to bring Dr. Babita Sandhu back to pave the way for us for the week after. In the new year, we have a naturopathic doctor coming to talk to us on how to grow our own organic foods in our homes. Hydroponics. I finally got how to pronounce it. Hydroponics, it's called. But we don't have to buy any gadgets or anything like that. She would actually show us how to use your own cups, your own, just glass cup or whatever you have to plant your own organic foods. We've been talking about all these toxins and poisons that we keep feeding ourselves. And we've been talking about being able to grow ours. If you're in California, you probably can have a farm because you have the weather to support that. In places like Maryland, DC, and other places where we have very cold weather, will learn that she would do both. So next week we would have Dr. Sandhu, and after that we would have, a naturopathic doctor, Dr. Gillum. So let's look forward to that. With no much ado, I say good night and look forward to seeing you next week.
Thank you so much.
Good night and
Thanks
welcome back.
again.
Good
you,
night,
Dr. O.
welcome
Thank you, Dr.
back.
O.
Thank you.
Bye-bye.
Good night. Welcome back.
Thank you.
Good night,
Good
Dr.
night.
Kapoor.
Good
Nice
night.
one.
Good
Akwaba.
night.
Akwaba, welcome back. Nice seeing your
Thank
face.
you.
Dr. O, I appreciate you too. Thank you.
Appreciate you so much. You don't even want to know. You are an angel for me.
Thank you. Good night.
Good night.
Mhm.
Good night.
Good
Good
night.
night. Oh, good night, baby. Thank you so much. It's probably 2 a.m. on your end now.
Welcome back and good night, ma.
Good night. Thank you so much.
Dr. O,
It's my sis.
do you have jet lag?
No, I don't get jet lagged.
You don't.
Mm-mm.
What is your
Actually went straight to work right after I got in.
really?
Yeah.
Well, I'm glad you're back.
Thank you.
Good night, everyone.
Good night.
Dr. O, I like the sharing aspect in Ghana. This is tremendous. I mean, sharing knowledge with our fellow brothers and sisters. This is significant. So whoever did it, you and whoever will get many blessings. And I'm hoping that could be part of an initiative that many others could do. I mean, in certain African countries that need that service, we could organize some sort of brigade that you could go from various places. I mean, those who close by can arrange something. So probably something Medical Monday can coordinate.
We can do that on Medical Mondays because I go to Kenya and I go to Nigeria. This is my first time in Ghana. So it can be coordinated and more people can join in. You cannot participate in one of these and be the same again. It's not possible.
I can imagine the experience, yeah. They say the more you give, the more you get, more you learn.
I think we get blessed, more blessed than even the people that are receiving, honestly.
A lot of blessings.
Because I feel blessed all the time.
Yeah. Well, all the best. Keep up the good work, folks. Keep on doing what we do.
Thank you. Thank you so much. And you know what? We had the opportunity sometimes, I won't say all the time when I go, we have the opportunity to empower people to actually start business for them. Okay. But we allow the Lord lead us. On this trip, that happened again. Now I'm gathering used clothes, shoes, what have you, to ship to a man to start his business. That was the business he did. And he lost his job during COVID. I don't know what happened. His wife had a baby 6 months ago. And the wife used to get fish from fishermen, smoke it and sell it. Her business crashed. They had nothing. Guess how I found out about them? She brought 3 children out of their 5 children to the mission field. One had abdominal pain. The first one I saw, 8-year-old. So I asked, what does he eat before he gets this? And he said, when he eats kenkey and rice. So Ghanaian food does not have a lot of vegetables and fruits. Kenkey is like fufu. And rice, is carbohydrates, it's all carbohydrates.
Yes.
I told the woman, I said, add vegetables and fruits to his food. And I saw her eyes became, red. But, she said, okay. Then She showed me the baby 6 months old with a rash. I took care of that. And then the 10-year-old girl says she has headache every day. So I was trying to figure out what kind of headache this girl has. Asked so many questions. Then I asked, do you have this headache when you're hungry? She said, yes. I said, why are you hungry every day? She said, when they come from school, there's no food until nighttime. Wow. So that got me to asking more questions. And I found out she doesn't even have food to give the children. Wow. So why was that? And, you know, one thing led to the other. We were able to help her restart her business so that she was going to start getting already smoked fish this week from people who have smoked it already, sell it, get it by credit, sell it and go pay them back. I'm like, she would have nothing left to feed family or to even get a capital ever. So we asked how much it would cost to start a business and was able to do that. But then it bothered me because you empower the wife. What about the husband? The husband is the one I really wanted to empower. But the wife was the one I was interacting with, and she could not very well verbalize the husband's profession. I told her to come the next day. I didn't have the money anyway that day. I needed to change money. It was her first day of mission. So she came the next day, and then after she realized what happened, she went to bring her husband to say thank you. That gave me the opportunity to now interview the husband. And so I'm going to collect, you know, the used clothing. She said she gets that, it will be able to roll, to start his business. Just an example of other things that the Lord does when we go on these missions. And believe it or not, it's not a lot of money to get somebody situated and, you know, be able to fend for themselves.
That is good work. So this mission, is it a yearly mission or often?
Well, I usually go once a year, but in 2018, I went twice to Nigeria because the need was too staggering.
It's great too.
In 2019, my children grounded me when my youngest son, see, you met two today. My youngest one is a lawyer, and that one is, oh my God, it's not on. Night is working. So he found out, I won't share, but he found out that I've been using my money for these missions, and he called his brothers, those two you saw tonight. They are tough. He called them and they grounded me that until I know how to raise funds, that I'm not allowed to go on missions anymore. But 2020, I snuck out again. I went to Nigeria and this time we were able to do Ghana.
That is wonderful. I just hope that experience empower and motivate others to fall in line. I mean, everybody can play a part wherever they are, in whichever country they are. So this
please stop the YouTube. Thank you.
The YouTube is not stopped?